All right, well, it's time to hear from our special guests this evening. So I do want to introduce to you Tony Gelsomino, who is the Director of Human Services for the City of Lakewood, and has some staff here with her. We are happy to have you all, and we are very appreciative of your time spending this, I guess, rather great evening with us.
Thank you for having us. I'm so grateful that you invited us to be here because we are in the weeds, Randy. And I thought that was a perfect analogy of the work that we do every day. And I appreciate that this group is interested in learning about that. I am grateful to meet new people and to see many friends that are committed to our residents as we are for many, many years. I have wanted to give you a little bit of history to Lakewood's commitment to health and well-being. It actually began with the original Lakewood Board of Health for the Hamlet of Lakewood, which was established in 1892. Fortunately, we've come a long way from inspecting tonsorials. We don't have to do that anymore. Barbershops are no longer doing that kind of work. So we know that Lakewood has always cared about health and well-being in kind of an unusual, a very progressive commitment to it. The Department of Human Services, comprised of aging, youth, health, and early childhood services, was established by ordinance in 1992, merging once separate services to provide a continuum of responsive programs and services that enhance and promote the well-being of individuals and families and community changes over time. That was the mission of 1992 when those divisions all existed. In 2008, with a national and potentially local financial crisis facing certainly our nation and potentially our community, the City of Lakewood identified core human services and eliminated those services that could be accessed through other organizations and were also not typically a function of municipal government. That was the time when we no longer provided public health. We now have a partnership and contract those services with Cuyahoga County Board of Health. Then in 2012, the city hosted a Human Services Summit and invited local and county human service providers to inventory services available to Lakewood residents, including populations served and any barriers to access, to identify gaps, prioritize community urgency, and suggest appropriate role of local government. Again, revisiting those early questions again in 2012. The findings of that summit were as follows. It was suggested that human services in the city of Lakewood serve as a monitor, that we must understand human service trends and issues and act on need, not necessarily providing direct service response to every need, but understanding that we have to build the capacity to support those needs. To serve as advocate, to serve as convener and connector. This is the place that human services, and you will hear actually probably from many of the people at this table, talking about the power of our partnerships and collaborations and being able to leverage services that meet needs that we are not able to provide, nor probably should provide as a municipal government. The city continues to serve as funder through general fund commitment to the support of these programs, and also allocation of CDBG dollars to support not only our own social service programs, but other programs in the community. And to be the provider when there is no one else to provide services. And you will also hear some of those stories when we talk about core services tonight. And what has become a greater need for human services is to begin to influence policy. And again, Randy, you know, you were talking, and I feel like you were in a number of our meetings this week. The policy around human services is critical, but it is difficult for, we have limited resources. That is not really our area of expertise. However, there are some places that we must take a stand because that is the way we're going to influence what we're actually able to bring back to Lakewood. The department didn't make drastic changes after 2012, but has used this barometer, those guides of those areas identified, in moving forward and evaluating our own value of our programs. I am going to introduce the staff that I brought here tonight because I really wanted you to hear from, and I think you're all Lakewood residents, I hope, from your experts. Jess Parker is the program manager for our early childhood services. Dee Dee McNamee Gold is the senior center manager. To my left is Colleen McNamara. She is the manager of our family-to-family program and collaboratives. And at the end, I can't see, is Katie Kurtz, who is our clinical manager for human services and works across the board in some of those broader reaching needs. So I'm going to hand my little baton to Jess and let her talk a little bit about young families, which is where I began, and many of you here crisscrossed in me, so I am grateful for that.
Hello, thank you. About 3.5, maybe almost 4 years ago, I was lucky and blessed enough to take over from Tony the early childhood division, which is me. I had I came to know Tony and this position from being a new family to Lakewood myself about 12 years ago. I had a young child. I was not from Cleveland, and I knew no one here. And I found the Lakewood Family Room, I believe, through the city's website. It took about 2 weeks for me to be there pretty much every day. I was a Monday through Friday girl. My now 8-year-old was there when I walked in when she was 3 days old because I had a St. Patrick's outfit for her, and she was going to wear it somewhere. The Lakewood Family Room is just one part of what I do, but it touches so many lives. I can honestly say that I bought a home in Lakewood because of the Lakewood Family Room, and I think we were talking about this, that we would find that was the case with many families, that it is and let me describe the Lakewood Family Room for those of you who don't know. Is housed in Lakewood United Methodist Church. It was in St. James Child Care for years before that. It is basically a large playroom that parents, caregivers, we have grandparents, nannies come to with their child or children. And what is so amazing there is watching the connections that are made. So basically, if you are a new family, I think especially if this is not your home base, and I'm seeing more and more people moving from large cities like Cleveland, or from Chicago or New York, when they decide that Cleveland's more affordable, but they do not have a support base here. It's the friendships that are made in that room that go on to give people a support system and really anchor them to our community. I know that's where my connections came from, and now I get to watch new parents making those same connections. Also through the family room, I am able to talk to parents. They are able to, see their child comparatively to other children. So child development is definitely an issue that I address often, and I'm able to make referrals and connections to other organizations like Colleen's staff, or Help Me Grow, or Connecting for Kids, which has become so important in our community if they believe that there's some sort of delay or issue of any sort. I'm also able to offer, in the last year, we've started offering programs from other organizations, so at no cost to our department. OSU Extension has come in and started to do a mom nutrition class. We've had achievement centers come in and offer 2 different infant massage classes in the last few months that were very well attended. In the past, we've had PEP do parenting classes, and we also have Asia is now meeting at the family room doing parenting groups for a Burmese population of Lakewood. So again, all of these things serve to connect with the other organizations and give them a place where they can meet Lakewood families. We generally have somewhere over 300 families walk through our doors each year. Last year, 177 of those families came in for the first time. That's not to say we don't have people that are coming still that were coming 10 years ago because they're on child number 4, but we are hitting like almost 200 new families a year and reaching 444 children in 2016. Beyond the things that happen at the family room, I also meet with all of the directors of the child care centers and the preschools once a month throughout the school year. We keep connected on various issues around the city. We lean a little bit into advocacy of what we feel is appropriate for preschools. This year we were lucky enough to have the city schools come and speak to us about the kindergarten curriculum. So we made some strides towards having our non-city schools, preschools, and child care centers prepare for what's coming in kindergarten. Also connecting with them, I offer the Early Childhood Child Care Scholarship, which is funded by the Community Development Block Grant, and I am able to help about 20 to 30 children, depending, each year have their child care paid for. So that's for families that do not qualify for the county's child care vouchers, which you have to make a very low percentage to qualify for. We're able to use the low to moderate HUD guidelines to help families pay for 40 to 50% of their child care. Another way we connect with the schools is through a Play-A-Day program that's been happening for at least a decade. It's an early literacy and family support program that myself and usually 2 other staff members that have backgrounds in education as well. We go into the schools on a weekly basis, have dinner, and support families through early literacy concepts. And I think that's it.
I think I can just use this mic. At the Division of Aging, over the past 10 years, we've seen a real increase in a younger senior who's experienced chronic poverty, mental health issues, or chronic medical conditions. We're fortunate to have some social workers who can help identify those problems and connect those seniors to community services. 2 items that are very important to the senior population are housing and combating isolation. A majority of the unbillable phone calls that we get are about housing. It's seniors who are looking for affordable housing, or maybe they want to relocate and they need information, or it's a family member who's trying to find advice and direction for how to get housing for their elder member. Isolation also is an overarching issue in the aging population. Regardless of the facts for a person's isolation, seniors who feel lonely and isolated are more likely to report poor physical and mental health. The National Council on Aging reports that 1 in 6 seniors living alone in the United States faces physical, cultural, and geographic barriers that isolate them from their peers and their community. This isolation can prevent them from receiving the benefits and services that can improve their economic security and their ability to live healthy and engage in the community. In Lakewood, 66% of the seniors who are registered participants at the senior center live alone. Connecting seniors to social resources at the senior center through activities, programs, transportation, meal delivery programs is essential to reducing this isolation. Division of Aging is using a number of methods. We have transportation to the senior center for program and activities. We transport for basic needs such as the grocery store or to the doctors. We recently formed a contract with Senior Transportation Connection for our medical transports. That allowed us to create more opportunities in the community to expand our transportation to include new outreach programs, such as the Cleveland Orchestra. This might appeal to a broader range of the community, which we were really looking forward to. We also work through developing our community relations and partnerships, which Tony referred to. We have meal programs at the senior center, both congregate and home-delivered meals. We serve 80 to 100 home-delivered meals Monday through Friday. Program and activities such as group exercise will help reduce isolation, loneliness, with that added health benefit. And we also have many volunteer opportunities. That's the Division of Aging.
This is that one? Oh, maybe it's better for easier. I don't like using either one, but I'll use. Hi, I am the manager for at the Division of Youth, and we have been in existence for many, many years. And in 2007, we were approached by the county, I think because of the solid relationship of having a human service department here in Lakewood. The Division of Children and Family Services had recognized a need on the west side for more support for families. And because we already had an established entity, which was our Division of Youth, we were kind of the perfect fit. So in 2007, we undertook a partnership with the Division of Children and Family Services with the county, and their requirement for our grant money was that we have staff that provide prevention services and support to families. Any household with a child in our service area is eligible for our services. We're very inclusive. We don't have any strict criteria except that you're a resident and you're in need of some support or help, or even just a plain old resource. We get many calls just for identifying a resource that might be available. But anyway, we do three things. We provide prevention, support to families. We provide intervention when necessary, when there are crises or we're trying to head off a crisis or help a family problem solve, or simply just regain stability because something happened within the household, either financially, financial, behavioral, something. And the third area that we try to focus on, and very much so the last few years, is enrichment services and support so that our families that come to us have places in the community to connect. I think Dee Dee had just mentioned about the aging population. Many residents have a loneliness factor, and a lot of our families have that same thing. I think about 90% of the families who come to us, it might be a little bit less, maybe 89, 90%, are single female-headed households. They have a lot of difficulty providing, I think, an income, maintaining their children, and not having the supports of years past when families, extended family members helped a lot. I think, as we all know, those barriers sometimes have been created for families, no matter who you are in the modern age. It just has happened. So a lot of our work is focused on trying to help the family maintain themselves where they are, connected to the community, or to help bring them along. And we have many partners that do that. And in the brochure, there's a page on the Lakewood Area Collaborative, and that collaborative was actually the kind of foundation for all the work that we do. And the intent is to bring together every conceivable person who's concerned with human health and is a service provider, an interested individual, a system representative. And over the past 10 years, we've had over 50 member agencies, maybe close to 70, people who have attended our collaborative meetings. And it's been a wonderful process. We get a lot of great feedback about how well the network of providers now knows each other. It's become kind of seamless. There's not all these doors. The no wrong door value, I think, is very apparent there. So it's a wonderful entity, and it meets monthly in Lakewood. Yeah. I think I want to, I can't move it over. I should have just used this. So some of the trends that we're seeing, like I said, many of our families are single, female-headed households, but we also have seen trends toward, well, more poverty, housing instability, just people not able to keep up with their household income and their children's needs. It's just a kind of a chronic thing. So we get a lot of calls for people who are getting close to eviction or have just been laid off their job and might not have an income for a month. And what we're really good at, I have 4 staff, 3 of them are master's level social workers with great experience, and the 4th is there should be a master's degree for Resource Connection. She's our resource specialist, and she's a walking encyclopedia for every support and service known to man. She's wonderful. So the trends that we're seeing probably follow along the same lines that Dee Dee mentioned, and we often talk about how common some of the areas are, but we're identifying, you know, just poverty issues, maintaining income. We have a lot of families who are now faced with their relative caregivers like grandparents, and they're being asked to take in 1, 2, 3, and a couple of our families like 5 children because maybe an adult child has a severe mental health or drug addiction issue. So the number of kinship families is growing for us on the west side. We also have a commitment to youth who have aged out of foster care, and the adage, they're all our children, is probably true, and we certainly support that. So over the years, we have actually really supported and helped a lot of young adults who just found their way. Some of them were referred, didn't want anything to do with us when they first met us, but they came back 6 months later knowing that where we were in the community and they were having a problem and they knew they could talk to someone at our agency. So that's another targeted population. Most of the families, though, that we work with are simply families trying to maintain their household, raise their kids, get their kids to school, just all the basics that we all do as parents. And the roadblocks that they run into, we like to think that we're just there to help them problem solve that. Many of them, even the ones that are referred, the vast majority of our referrals the past few years do come from the Department of Children and Family Services, so that means there was an issue related to abuse or neglect that may have happened with that family. But to the county's credit, the last 10 years, they have tried very hard to divert families from their system if at all possible. So we work with a lot of families where the county will refer to us because they feel like it didn't rise to the level for their mandated services to kick in, but they felt the family was really struggling with a lot of other things, and they hoped that we could help. So the community partnerships that we've developed over these years have been just absolutely phenomenal. Lakewood City Schools has been one of our strongest partners. Just 2 weeks ago, they opened their doors for our quarterly family social events. We had about 100 family members, I think about 30 families, a couple weeks ago for an open gym night. And the principal was our cook, he's our head chef. But we have these events because a lot of our families don't have a lot of social connections. They're lacking a place to go, so it's a real fun event for them, and we're hoping to grow that. And also trying to develop a lot of parenting support programs where not so much classes, but places where, as Jess described, you know, you can go and just get support for your parenting, for trying to solve problems that are related to parenting. So I think that's about it. We offer also a continuum of services. It could be one phone call to our resource specialist. It could be an intensive family wraparound services where we're really building a team to help support the family. And sometimes for the long haul, it could be 18 months or so in some places where there are very complex issues involved. So, thank you.
Good evening. So we're so fortunate to have a full Department of Human Services, and it makes sense that we're divided by age, by early childhood, youth, and seniors. And I sort of come in because there are a lot of issues that connect all of us across the lifespan. There are a lot of age-related risks, and They're issues like mental health, addiction, poverty, and then they even go deeper to deeply rooted things like trauma, or historic poverty, and racial disparities. And these are things that are, I appreciate what you were saying, Benjamin, that there's a fine line with prevention and intervention, and there's also so much we can do, and that's why we are so diligent in creating not just relationships in the community, but really strong collaboration and partnerships that are cultivated each day so that we can support residents not just to survive in Lakewood, but to thrive in Lakewood. And we really are diligent about creating a really solid yet adaptable foundation so that we're preparing for demographic shifts. We're preparing for some of the forecasting that's coming down when we talk about trends, not just nationally, but countywide and citywide. When we talk about seniors, by 2030, we're looking at about the 60-plus age bracket. We're looking about a 30% increase in age, those baby boomers aging. So that's going to be by 2030, that number will be outnumbering youth 20 years and younger. So we're looking at a significant, we call it, there's this big term called the silver tsunami. It's coming, it's here, and we have to adapt. We, again, have to create that solid yet adaptable foundation and rely on our partners. We also are looking at how when mental health occurs to one person, when addiction happens, it doesn't just happen to that one person. It affects their family, their friends, their neighbors, their community as a whole. And it also impacts a lot of different things: chronic illness, housing, transportation. It's very complex, and that's why we work together, and then we work with our community, county, and regional partners to really start looking at these issues and finding sustainable solutions for our residents. A great example of that is mental health. We all have physical health. We all have mental health. Some of us are born with genetic predispositions or a trauma or something that develops, or one thing can happen to any of us at any moment, and something may happen and we never know. So we need to be prepared and ensure that not only are we providing and connecting services, but we're breaking down stigma so that those people aren't living in shame. They can be connected. Addiction is huge. So we saw in January, for the last several years, the city of Lakewood's been committed to talking about the opiate public health crisis. In January, when our numbers came out, we saw a 66% increase from 2015 to 2016. And through our leadership and our Department of Human Services, again, with our partners in the community, we came together as conveners and connectors. And since January, we were approached by the County Adams Board, so I know acronyms, Alcohol, Drug, Mental Health, Addiction Board for Cuyahoga County approached us and said, with our strengths, and also because we strategically looked at our gaps, how can we start addressing the opiate public health crisis in Lakewood? So we are now creating a project called Project SOAR. It's supporting opiate addiction recovery, which will be using Lakewood as kind of a pilot hub, working with partners like the Woodrow Project and the Cleveland Clinic Emergency Department to create a peer support specialist model and the county is willing to evaluate it to see if we can really create something that will help reduce overdoses, not just here in Lakewood, but then can be spread out to other communities. That's such a perfect example of what we're doing, but we can be replicated when it comes to other issues. We work really closely with our interdepartmentally public safety. Last year, our police and first responders started to train in the crisis intervention team training that was put on, again, through the county. So we have 25% of our police force have 40-plus hours in mental health first responder training. So at any time, any resident in Lakewood, if there's a mental health crisis, suicide attempt, anything related to mental health, there's an officer on staff that can respond. They have excellent training, and we work closely with them so that on the other end, we can come in, see what's going on, and connect them to services. Again, we may not provide them because we're not a mental health organization, but we have people on, not just within Lakewood, but around, who can really provide and swoop in with those resources because we're able to identify the problems. So I think when we're looking at Human Services, it's so complex, and we, again, that foundation of collaboration partnership is so key and something that I know I rely on every day and that we all rely on so heavily because of what we're dealing with, which is essentially population health.
I'm sure you. So that is kind of an overview. What you have is some handouts with some numbers and some stories. One of the things that you didn't hear about, and I really want to make sure that I reiterate trends, because I hope that for you guys, it's important to know what we do, and hopefully to know who we are, so that at any point you have a question, call one of us. We can also help be your on-the-ground support staff of gathering information to understand something, although you have a mighty force around this table. But we can tell you a little bit more about what we see every day and have for quite a number of years and in our community. So the pieces that did not come up, that I didn't want to bring every single staff person, not that we have that many, but juvenile diversion is exactly what it is. It is a way for our young person who may make a mistake and have an opportunity to not enter juvenile court, but to actually do some community service and kind of get things back together. But I will tell you that our the number of truancies that we are receiving referrals from has been growing. So that is important. It's something we go back and talk to the schools about. One of the challenges that our diversion officer finds is the journey the parents are going through so often impacts what is happening for the child. So again, we go back to what Colleen says, the need for support of parents in the journey of raising a child. It isn't always easy. If you add any of the complicating factors that were discussed this evening, you can imagine how difficult it is. And it's particularly difficult if that has been your entire life's journey. The other thing that is important, and this is really a thing to celebrate, and I could never not say this with Vicki Smigalski sitting there, is our service learning program, which is our H2O program. And Brittany, I'm looking right at the chairs of our next fundraiser. Yeah. Anybody looking for more volunteer work? Right. That, and again, you know, I don't ever want people to walk away in our community and think, oh my gosh, there's just so many tough things happening. There are really hard things happening. But I turned 60 this year, and I can tell you that there have been tough things happening the whole 30 years that I've worked. How we respond to those, how we as a people choose to allocate resources, to be thoughtful in what we support. Quite frankly, it is remarkable that the City of Lakewood continues to support a Department of Human Services. No matter what challenges we have experienced ourselves, it says something about who we, the people, are of Lakewood. And I look to all of you and say, you are also the people who have a very big job ahead of you. But I want you to know that we are here. I hope that what you've heard will not only provide information about trends, but that you will have seen evidence of population health interventions and the value of community conversations about population health and what that means to our friends and neighbors. Evidence of population health is so much of what you heard this evening. When we are talking about addressing isolation, we didn't really even talk a whole lot about accessibility to supports, but that is certainly a critical need. Mental health interventions, the support of parents, addiction response and intervention. Whether it is provided by us is not the most critical factor. The most critical factor is that we recognize that need and we build the capacity to address those concerns in our community. Human Services and our collaborative partners are committed to strengthening the capacity of Lakewood residents to be able to adapt, to respond to, and to control life's challenges and changes. How wonderful that would be. Each one of us, I believe, is on that journey in our own way. Some people, it's a little tougher journey. If we can provide interventions and support along the way, you can make a big difference. So I hope that you take advantage of the team that is in the city. You can stop by, you can talk to us. We're not hard to reach. And if there's any questions right now, we gladly take them.
I don't have a question. I just want to say that every time I hear a group like yours talk, I am so grateful that I live in Lakewood. I really am. Such, such great people doing such great things, and I think, wow, what a city. So that's all.
Thank
No
you, Phyllis.
questions.
Can I have that in quotes?
Yeah. I'll write it
No,
down.
I agree. Yeah. Judy?
About how your department is responding to the refugee community in Lakewood. My impression is that it's a growing need, and I'm curious how that fits into your existing programming and if there's new issues that have emerged.
You know what's interesting is, and any of you can jump in at any point, but what I have found with the refugee community, and we actually work very closely with Stacy Dever and Tom Roscoe at Catholic Charities, so they are kind of our communicants. And so one of the things that when we actually started seeing more refugees relocate to Lakewood, which is now getting to be a while ago, one of the things that we found as a city is that refugees had, like, I don't know, 3 days or 3 months or 6 months with Catholic Charities, and then they were kind of like, okay, live and enjoy America. And I would think, oh my God, how frightening. And there were things that happened that, didn't work out so well. So the community, and I will, again, another proud moment of our community, we pulled together all the resources of this community, and we created, with Catholic Charity, a couple of van trips so that we went on the road with refugees, with translators. And we talked about particularly fire and police because there was so much fear and angst around both of those entities. Some of my favorite moments were the kids being allowed to climb into the uniforms so that we could really do away with some of the fear. But with that experience, we really built a very strong foundation with Stacy and Tom, and the fact that they're still there makes a huge difference for us. As far as the refugees actually using our resources, that doesn't happen a whole lot. Part of that is language. That still is a barrier for us. It's a struggle we have. Just recently, when it comes to interpreting services, we still haven't figured that out very well, quite honestly. Not just us, but almost any place I talk to when I'm trying to search this out. But also that families and communities stay pretty close. We did, shortly before I accepted this position, we did a program at Harrison based on really a community volunteer who was a Montessori school teacher who came forward and said, I will teach a summer program for kids who are refugees. And we did a parenting program why those kids were, because we were giving them a little extra before they went into actually pre-K. Because we recognized that the teachers recognized, particularly at Harrison Elementary School, that that was a very important piece that was missing. So we have done things like that, Judy. Right now, Jess is really beginning to build a strong relationship with Asia. And certainly, Colleen works with Asia a lot around their families. But it's not, I don't think it's where it should be or what it should be, or what it has the potential to be. When we, Lakewood Alive recently did a forum on refugees, and I very much appreciated, a woman stood up and said, we need to have more family room services for the refugees. And I was like, who is that? And so as she stood up, she was the mother of a child who had gone to the family room, who happens to be a medical professional, her child had battled a pretty severe illness, but had this community of people who supported them as a young family in Lakewood, and said this made a huge difference for us. She, as a nurse practitioner, served the refugee population and said, I wish there was a way for us to link those together more. That said, those are all things, of course, we would love to do more. We're limited by space. You know, I will tell you, you'll hear me, and anyone else that listens to me, as Shannon probably smiles, I'm pitching for a new community building in our city. So my hope is someday, I won't be saying that someone after me will say, we have this great space and we use it for all these things. So I think that that is probably an area that there is more work needed. How we can do that because of some of the challenges is something, you know, we're attempting, but it's not very simple. Yeah.
So this is a great example of an issue that's bigger than us. And so although we are always looking at this issue because it so impacts not just our community, our schools, everything. And I will say that we have to have our finger on the pulse of what's happening in Lakewood, but we also have the opportunity and need to be looking at what's happening county, state, and nationally, and what policies are trickling down that will directly impact us. So we have that opportunity in human services to really hear what's going on and really work with organizations like Catholic Charities, Building Hope in the City, Refugee Response, because they're doing that direct work. We're oftentimes so busy, or they're so busy doing that direct work that we have to kind of lift our heads up and say, well, what's going on? Like, what's coming? Are we prepared? How can we look at creative solutions to age-old problems? So that is one that's always something where all of us, I think, across human services is looking at, but we're grateful to partners like Lakewood Alive, who's bringing those conversations to the community, working with Catholic Charities if there's a family in need, but there's always something ongoing.
I think we have time for one more question, but it sounds like if other questions come to mind, they're more than happy to answer those the email, or they invited us to drop by.
Our contact information is all on the last page of that.
Did anyone have a final question they wanted to fit in? Because I do. No one else does. Okay. I guess if you could, and I don't want to take us down a rabbit hole here, but if you could identify, I know, never started something like that, but if you could identify what some glaring gaps might be, because what I've learned just from your short time here is that not only are you providing direct services, but you also act very much as connectors to other resources, locally, countywide, whatever, federal level. So having all of that knowledge, are there really glaring gaps that you're seeing where needs are not necessarily being met that would, you know, considerably have a high impact on human health?
Do you want to? Sure.
I just wanted to mention, you had mentioned earlier, I didn't get a chance to touch on that, so it's a perfect question, but I do think that accessibility is a big issue. We have a lot of families with a lot of needs, and probably the gap is in getting connected to whether it's health, school-related, it doesn't matter, but sometimes families just don't have the resources to get themselves connected. A good example of that is, for us, we might have a family who's involved with the Department of Children and Family Services for something, and we're working as a team and collaborating not only with them, but also maybe with the mental health provider. They have a case plan, and they're supposed to get their kids connected to certain services and themselves to parenting and mental health. And if anybody has taken a bus recently, the cost of like taking a bus and with kids during the school year to get anywhere is often an obstacle for these families, like completing a case plan or just getting mental health treatment or going to recovery. It's very expensive to travel around the community. And so I would say that that is and it's not easy. And I do think that that is a very common, like almost an everyday occurrence. It's an obstacle presented by one family or the other, that they just don't have the resources to get where they need to be to make use of the services that are available is the gap, I think.
Thank you.
Do you want to weigh in a little bit about mental health?
Yeah, and I would say that accessibility, especially transportation, is a universal across the lifespan, whether it's getting to childcare with young children, families down to county or different mental health providers, seniors is a huge, senior transportation is a huge conversation. And then all those adults in the middle, I kind of, like these 18 to 59-year-olds that sort of fall in my camp of human services world that unfortunately don't qualify for a lot if they're low income or just that not poor enough kind of category, unfortunately. So accessibility is huge. And then we're looking at that kind of social, emotional, mental health bubble. There are a lot of gaps just because it's so directly impacted by insurance, that kind of accessibility, and also what resources are available and the quality of resources. It's not uncommon that we'll have somebody call us and say, I don't know who my social worker is, do you? And we're like, well, I don't know, because they have to try to navigate these systems that are so pervasive with red tape, and there's so high turnover at these large systems, and that's, again, universal, whether it's at county level with child and family services, job and family services, adult and senior services. There's lots of systems that are really hard to navigate and understand, and if you don't have the literacy to understand healthcare terms or mental health care terms or Social Security, all of these things are hard to, I have a master's in social work. I can barely understand half the paperwork that comes in the mail to our older adults. So I think that across the board, and just being able to, accessibility is right. It's accessibility to a lot of different things, transportation, understanding the services, navigating services, and we're really fortunate that we have poised ourselves as resource navigators because we can connect and have relationships and are always seeking out new relationships with other community organizations so that any call that comes across any of our offices, I don't know will never be an answer. It will always be, if we don't know, we'll say, that's great, we're gonna find out for you, and then we diligently find out because we wanna know too, so that we can help that next family.
Thank you.
And Erin, I have to, add the fact that we are in a time of great uncertainty and change. And so how healthcare is what that is going to look like, what government local funding will look like, what CDBG will look like, what many sources that have been able to support often some of the work that you might hear from us, but also our partner agencies. We have no idea what we are going forward into. And so my hope is that as much as it's important for you to talk to those of us in the weeds, it is also important for you to understand those changes that are coming and be thinking about how that is going to impact the people in the weeds and how this role maybe, I'm actually sure, will be far more critical than ever before. And I'm sorry Jess had to leave, and she's not feeling well, so.
I just want to say one more thing, that when you hear what we do, it's a lot, and there's a lot of different complex needs that we're looking at, but I think the single most important thing to take away is that our underlying goal is always to empower people, even at the most vulnerable state of where they're at. Empowerment is always the underlying goal, to empower them to understand, to make decisions, to when we look at the opiate crisis, to empower families to share their stories, even if it's as small or as, advocate for what they need. Across what we do, it's always about empowerment and trying to help people be their best.
Thank you. Very informative. No, extremely informative. We really appreciate your time so much. Thank you.